Hello, बच्चों, and welcome back to the Clinical Anatomy Case Discussion Series. यह है series number 8. And so I'm sure students, you must have seen the previous case discussions. You must have got an idea about it, and you must be definitely confident, है ना? तो चलते हैं आज के series का ये series का आखिरी सवाल. The last question of this series of upper limb. Okay, have a look at this. So a 19-year-old boy falls on an abducted, externally rotated shoulder. मतलब ये खेल रहा है बंदा. He's playing and his arm is abducted and externally rotated and he falls down. ये गिर गया नीचे. Sustains an anterior shoulder dislocation. ठीक है, ये खेलते खेलते मतलब ये ऐसे खेल रहा था तो आर्म को he has abducted and it was laterally rotated. He falls down, the shoulder dislocates anteriorly. After reduction, he cannot abduct the arm. He cannot abduct the arm and has numbness over the lateral shoulder. Lateral aspect पे numbness है. Abduction is lost. Abduction कौन करता है? Abduction of the arm as well as numbness on the lateral shoulder. Anything clicks? कुछ click हो रहा है? Something clicks to your mind? Sensations on the lateral aspect of the arm is lost along with abduction. कौन है ये? Which is the nerve? Which is the nerve which supplies the muscle which causes abduction? वो जो nerve है, it supplies the muscle जो abduction करता है, plus there's a loss of sensations here. Which is the nerve? Axillary nerve. Axillary nerve. कैसे analyze करोगे? How do you analyze this? How do you analyze this? देखो, कैसे? How do you come to a diagnosis? Abduction. You know abduction at the shoulder joint. हाँ, abduction at the shoulder joint. चलो ये फटाफट देख लो. Abduction at the shoulder joint 0 to 15 degrees कौन करता है? Supraspinatus. ये हमको पता है. Supraspinatus. 15 to 90 degrees कौन करता है? That's deltoid. And 90 and above, it's done by Serratus Anterior and Trapezius. Serratus Anterior and Trapezius, right? So 0 to 15 degrees is done by supraspinatus, 15 to 90 degrees is done by deltoid, 90 and above is done by serratus anterior and trapezius. Plus, who supplies the deltoid? Who supplies the supraspinatus? That's a suprascapular nerve. Suprascapular nerve, है ना? Who supplies the serratus anterior? That's the long thoracic nerve. Long thoracic nerve, and trapezius is supplied by spinal accessory nerve. Spinal accessory nerve and the long thoracic nerve. Deltoid is supplied by axillary nerve. Deltoid is supplied by axillary nerve, plus axillary nerve क्या supply करती है? It supplies the skin on the lateral aspect of axillary nerve. It supplies the deltoid and teres minor, and it supplies the skin on the lateral aspect of the arm. Skin on upper lateral aspect of arm. Upper lateral aspect of arm. हाँ, तो ये आपको पता होना चाहिए टू अंडरस्टैंड दिस एमसीक्यू. उसमें एमसीक्यू में क्या लिखा है? द पर्सन हैज डिफिकल्टी इन एब्डक्शन, देयर इज लॉस ऑफ सेंसेशंस ऑन द लैटरल एस्पेक्ट. सो व्हिच इज द नर्व इन्वॉल्वड? एक्सिलरी. द नर्व इन्वॉल्वड हैज टू बी एक्सिलरी. समझ में आ रहा है कैसे डायग्नोसिस पे आए? सो एब्डक्शन एट द शोल्डर जॉइंट 0 to 15, supraspinatus 15 to 90, deltoid which is supplied by axillary nerve which also supplies the skin on the upper lateral aspect of the arm, and loss of sensations of the skin on the upper lateral aspect of the arm. What do you call this as? देखा हमने previous MCQs में देखा है. What is this known as? Anyone? Yes. Regimental Badge Sign. Very good. उसी को बोलते हैं अपन Regimental Badge Sign. And 90 and above is done by serratus anterior, trapezius. Serratus anterior is long thoracic nerve. Trapezius is spinal accessory nerve. Fine. So we come back to this question. So which is the nerve injured? Which is the nerve injured? Axillary. Axillary nerve injury हो गई. Which space does it traverse? So axillary nerve कौन से space से जाती है? देखते हैं. चलो, I'll just draw a slide for you. बच्चों ऐसे ना, you should be able to draw such slides. That's a scapula here. This is the humerus here. Now you tell me, what is this muscle? ये कौन सा muscle है which begins from the infraglenoid tubercle? What is this? ये है long head of triceps. Long head of triceps. ठीक है. What is this muscle? कैसे draw करूँ? Okay. What is this muscle which begins from the scapula and goes to the humerus? Scapula से humerus तक, what is this muscle? That's teres minor. teres minor. And what is this muscle which begins from the scapula and goes anteriorly, anterior aspect of humerus? ये anterior aspect of humerus पे गया. It is inserted on the medial lip of the bicipital groove. It is inserted on the medial lip of the bicipital groove. What is this muscle? So this is the teres minor inserted on the greater tubercle of humerus. ये जो muscle है, it is going in front and getting inserted on the medial lip of the bicipital groove. This is the teres major. Teres major. So ये teres minor, teres major, long head of triceps. You get three spaces here. ये क्या space है? Upper triangular space. What is this space? Lower triangular space. And what's this space? That's quadrangular space. Quadrangular space. बराबर? Upper triangular, lower triangular, quadrangular. What passes through the quadrangular space is the axillary nerve. यह है axillary nerve. And axillary nerve के साथ there's an artery which goes. What is this artery? This is the posterior circumflex humeral artery. Posterior circumflex humeral artery, right? So what passes through the quadrangular space is the axillary nerve and the posterior circumflex humeral artery. What passes to this lower triangular space? एक artery and एक nerve जाती है. What's this nerve? Radial nerve and profunda brachii artery. Radial nerve and profunda brachii artery. Radial nerve and profunda brachii artery. And what passes to the upper triangular space? यह है circumflex scapular artery. Circumflex scapular artery. ये clear है? ये सब MCQs में आता है, ये सब वाइवास में भी पूछता है. So quadrangular space के boundaries भी देख लो, upper triangular, lower triangular space के boundaries देख लो. So who passes through the quadrangular space? The axillary nerve and the posterior circumflex humeral artery. Boundaries above teres minor, below teres major, medially is the long head of triceps and laterally is the surgical neck of humerus. Fine. So that's the quadrangular space. ये है upper triangular, ये है lower triangular space. So which space does it traverse along with which artery? That's a quadrangular space. And nerve कौन सी है? Axillary nerve, artery है posterior circumflex humeral artery. Perfect. Which movements are most affected? Which are the movements affected when axillary nerve is injured? It's abduction and lateral rotation. बराबर? Axillary nerve supplies दो muscle को supply करती है. Axillary nerve supplies the deltoid and teres minor. So deltoid का action is abduction, teres minor का lateral rotation. ठीक है ना? So which movements are affected? Yes, deltoid. And deltoid does abduction. Abduction from range क्या है? We're off from 15 to 90 degree, right? So which movements are affected? Abduction 15 to 90 degrees. दूसरा teres minor is paralyzed, so lateral rotation is affected. And what is the lesion of the cutaneous affected area? So which cutaneous area is affected? Upper lateral aspect of the arm. ये sensations जाएंगे. And इसे हम बोलते हैं, what do you call this as? Regimental badge sign. Regimental badge sign. So regimental badge sign is seen in lesions of axillary nerve. Okay, बच्चों ये clear है? So this entire clinical case discussion is based on axillary nerve. Axillary nerve दो muscle supply करती है, deltoid जो abduction करता है 15 से 90 degrees तक. दूसरा है teres minor which does lateral rotation. Plus axillary nerve supplies the skin on the upper lateral aspect of the arm. Loss of sensations यहाँ पे we call this as regimental badge sign. Regimental badge sign. So I hope this MCQ is clear to all of you. Yes. And आपके लिए एक this clinical case discussion and a special MCQ for you. Quadrangular space contains, yes, which of the following? A, B, C, D. Answer करिए comment box में. Answer this MCQ in the comment box. So I'm sure students, you are able to understand this complete series of clinical case discussion of upper limb. ये complete playlist देख लो. Entire thing will be clear right from the beginning. हाँ, part 1 से लेके part 8 तक ये पूरा series देख लो. I've prepared a thumbnail, I've prepared a playlist for this. Just see all these things. Your clinical case discussion of upper limb is going to be perfect. If you have any things, if you have any problems, any doubts, you can write in the comment box. Thank you so much. Thank you to all of you. Thank you.